Hello everyone. In the last lecture, we have discussed about introduction to anatomy. In this lesson, we are taking a look at the vertebrae. So, what is vertebral column or vertebrae? Vertebral column is made up of different bones placed over each other. These are the short, spongy bones placed over each other in a series. It is not a single bone, but it is made up of individual bones. So, these are 26 in number, 33 in a fused one. So cervical, thoracic, lumbar, sacrum, coccyx are its main divisions. Cervicals are 7 in numbers and thoracics are 12 in number. Lumbar are 5 in number, and sacrum, that is S1 to S5, but it is a fused bone, it is counted as 1. Same in the case of coccyx. Coccyx are 4, but it's a fused one, so it is counted as 1. So we'll initiate our uh, topic with the typical vertebrae. The diagram of a vertebra over here, we can see a vertebrae should have its 5 points, so that we can say that it's a vertebrae. Just like it should have spinous process, transverse process, vertebral foramen, body, articular process. These 5 points make a typical vertebrae. If we'll take a vertebrae out of the vertebral column, and we'll see that it has spinous process, transverse process, vertebral foramen, body, articular process, then we can easily justify that it's a typical vertebrae. Just we'll initiate our bones with the cervical one. Cervical are the smallest and are characterized by a foramen in a transverse process. So there are the process, transverse process, but spinous process. Basically, spinous process helps when we bend at the back side of the body. Then spinous process helps into supporting our body and the structure of our body. And the transfer process helps when we move laterally, when the movement is laterally. So transverse process helps in that. Then there are the vertebral forum. Main function of vertebral column is just it carries spinal cord, and spinal cord is a part of CNS. Then there is body. Body also bears weight of a body. When we come downwards from cervical to lumbar, we'll see the difference between cervical and lumbar. There is a body's difference. Body is more wider in lumbar, more thick, and more rigid. It's just like that, and it also carries the weight. And from lumbar, the weight is transferred to the sacrum, from sacrum to the hip bone, and from to the femur and all that. But we continue with the cervical. So cervical are the smallest, and atlas, that is a C1, it supports the head and form atlanto-occipital joint. Atlanto-occipital joint, atlanto comes from atlas, occipital comes from occipital bone of the skull, and it both articulates and forms the atlanto-occipital joint. If we'll see the diagram of atlas, here we can see it has two laminas and tubercles, posterior tubercle, anterior tubercle, transverse process. In that, transverse foramen is present, and transverse foramen is carrying vertebral arteries to the brain, and it supplies the brain. So simply the transverse process, foramen carries vertebral arteries. Then there are for body, it do not have body. The main difference between C1 and C2, it is the presence of body. In C1 no body is present, in C2 present body is present. And in C1 the vertebral foramen is triangular in shape, and it also has articular facet for dens. What is dens? Dens is basically dens or odontoid process is present in C2. It it actually make a atlantoaxial joint for the movement when we move our neck. So these atlanto axial joint helps in the movement of our neck. So basically dens articulate with the articular facet for dens of C1. Here we can see dens process in C2. So we'll take a look at the C2. C2 is also known as axis, second vertebrae. acts as an axle for rotation of the atlas and head around the strong dens, which projects cranially from the superior surface of the body. So, again, we'll talk about the C1 and C2 differences. In C1, the vertebral foramen is wide, triangular in shape, but in C2, it is just simply uh, small in comparatively to the C1. Then the foramen process foramen transverse foramen is present in both of the cervicals, and C2 also has spinous process, transverse process, but C1 do not have spinous process, and C1 do not have body, but C2 have a prominent body over here, we can see. Then C2 has articular facets for C1, articular facet for C3, and the dense process which articulate with C1. So we'll take a look at the C7. C7 has some property which it inherits some property from the thoracic one. The C7, the seventh cervical vertebrae, the vertebra prominence has a long spinous process which is visible at the lower end of the nuchal furrow. Then uncinate process, the bony spical dividing foramen transversum, costal lamella. So all these structures you can easily switch to Netter's atlas. You'll get all the details of the diagrams from the books, and you can use any reference book. Then the uncinate process lie adjacent to the transverse process. The C7 also has pedicles, then laminas, the superior facet, the inferior facets, and the septate transverse foramen. So, in the next lecture, we are going to continue our topic of vertebrae with the thoracic, lumbar, sacrum, and coccyx.